Hello, I'm Dr. Ramsey, Amin, and a conversation I had with a patient the other day stemmed this video about two complications that you should know about that can occur late in the life of having dental implants. They don't happen too often, but it's important to understand that even after having a dental implant or several dental implants, that things can occur. The two that people don't consider too often, the first one being fracture of porcelain, meaning the crown or bridge or dental implant restoration loses a chunk or a piece of the porcelain comes off. And the second complication, long-term complication, is bone loss around the implant. The two are somewhat interrelated in that they both are caused oftentimes by the same reason. Number one being a really strong bite. People that grind their teeth or clench their teeth put a tremendous amount of force on their teeth. Uh, the force that we put on our teeth at night when we grind them is far greater than anybody ever would do during the day. And people that grind their teeth oftentimes break their own natural teeth. Your natural teeth are the strongest structure in the entire body. They're stronger than your own bones. So to be able to break natural teeth, being able to chip or break porcelain can and does occur. Sometimes it occurs slightly higher in dental implants because an implant does not have a shock absorber in order to somewhat cushion the bite like a tooth has. That's called a periodontal ligament or PDL. And dental implants do not have a PDL. They're just fused directly to the bone without a shock absorber. So in some cases where a patient could bite down really hard, something has to give. And usually it's nothing, but if it is, it's going to be the weak link, which is the porcelain. This can be remedied by different design of the implant bridge or tooth or full implant restoration by adding or supporting it with more gold alloy metal underneath the porcelain, or perhaps having a metal biting surface. Bone loss, again, occurs for similar reasons. Sometimes porcelain fracture and bone loss occur because of under-engineering. And what I mean by that is many patients, and doctors for that like, try to sometimes place as few implants as possible in order to save the patient costs. But what ends up happening is that if there's too much force on too little foundation, the bone is what takes the stress, and that bone begins to kind of pull away at the neck of the implant. A slight degree of bone loss generally is not a problem at all, but if it advances over the first several years of having the implant, it may lead to the loss of the implant, deepening of pockets, or perhaps, again, fracturing of porcelain off dental restoration, meaning the porcelain crown or bridge. In bone loss situations, oftentimes I'm able to regraft the bone that has been lost, put it back, reposition the gum line, because oftentimes the gum will recede, leaving a pocket. That gum can oftentimes be repositioned. Porcelain can oftentimes be repaired, or the dental restoration, implant restoration can be removed and re-veneered with porcelain again. So there are oftentimes simple ways to remedy these complications that can occur in the long term of having implants. But I really think it comes down to initial design, planning, how many implants you have, your bite, taking that into account. There are many factors than just putting a screw inside your jaw and putting a porcelain cap on top of it. The lab has a big factor, and the lab that the dentist chooses to use, and how skillful they are in working with the dentist in making your dental implant, crown or bridge or denture fit as perfectly as it can, so that it can hold up to the long term and prevent complications like bone loss and fracture of porcelain. If there's any questions, please feel free to comment below. I make it a point on trying to get back as soon as possible to patients and people interested alike. And thanks again. This is Dr. Ramsey Amin. I'll see you next time.